Welcome to Language Access Matters, the podcast that dives deep into the crucial role of language access in public services and businesses. I am your host, Carol Velandia, and I invite you to join me on a journey of discovery and empowerment. Language access is not just a matter of convenience. It is a fundamental human right and the key that unlocks doors to essential services and opportunities. In this podcast, we'll explore the far-reaching impact of language access, examining how it shapes not only healthcare, justice, and education, but also the world of business. Through thought-provoking interviews, insightful discussions, and compelling stories, we will unveil the power of language access. We will hear from professionals who bridge communication gaps to provide quality care for diverse communities. We will explore the intersection of language, law, and justice, and the crucial role that interpreters and translators play in ensuring fair and equitable treatment. We will delve into the challenges and innovations, as well as how language access opens doors to effective communication and inclusion, and how it makes our society more equitable. But our exploration doesn't stop there. We will also uncover the profound impact of language access in the world of business. We will hear from entrepreneurs, industry leaders, and experts who understand the value of inclusive and effective communication and how it drives success in today's global marketplace. Language Access Matters is your platform to understand the significance of language access in these vital sectors of society. We will shed light on the barriers faced by individuals and communities and the innovative solutions that promote inclusion and equality. Whether you are a healthcare professional, a legal expert, an educator, a business owner, a linguist, an advocate, or simply passionate about the power of language, this podcast is for you. Together, we will navigate the challenges, celebrate the victories, and advocate for a world where language access truly matters. So, join me on this enlightening journey as we uncover the impact of language access in healthcare, justice, education, and businesses. Let's amplify the voices of the 25 million people that don't speak English in the United States and those that don't speak the dominant language around the world. Those voices deserve to be heard and empowered, and we need to empower ourselves to build a more inclusive future. Welcome to Language Access Matters. Let's embark on this transformative exploration together. Amy Greensfelder is the Executive Director at Pro Bono Counseling, where she supports board, staff, and volunteers in increasing access to mental health care. She joined PBC in September 2017. Amy is a licensed certified social worker and a graduate of the University of Maryland Baltimore School of Social Work. Previously, she served as the Maryland Department of Health's Refugee Mental Health Program Coordinator. In that role, she developed the State of Maryland's Refugee Mental Health Program, which includes screening of newly arrived refugees for mental health concerns, support groups, training of mental health providers to work with refugee populations, and training of interpreters to work in mental health settings. Additionally, she has worked in overseas processing of refugees seeking admission to the United States and domestically in immigration legal services. She lives in Baltimore City, Maryland, with her spouse, first grader, and 6 chickens and a few goldfish. Welcome, Amy. A pleasure to have you here today with us at Language Access Matters.
Thank you so much for including me in this podcast.
Absolutely. I am delighted. Amy, please tell our listeners who you are, a little bit about you and what you're working on these days.
Some things that I'm working on right now are just leading Pro Bono Counseling. We're a nonprofit that offers free mental health care through a network of 800 licensed mental health professionals. So that's the core of my work. I am a social worker. And I'm always working on increasing access to mental health care. Some projects we're currently working on are collaborating with other organizations on workforce development around increasing the number of Spanish-speaking mental health professionals. And I'm currently participating in a leadership cohort called Leadership Baltimore. And it's been a really great year-long experience to hone leadership skills.
And Amy is one of the people I admire very much because she has tackled something that is absolutely important for our society, which is mental health, where language access plays a particular role. Amy and I met during a master's in social work, and I know that language access has been a passion for you, Amy. That is how we became friends, in fact, right? To
Yeah.
me, it is very interesting when anybody feels drawn to this topic. And I want you to tell our listeners, how did you become interested in the topic of language access?
Yeah, I'm just so glad to be doing this with you, Carol, that our friendship has evolved in this way over the years. Early in my career, I got involved with refugee and immigrant legal services. And that was over 15 years ago, and it was in North Carolina. And at that time and in that place, there really wasn't much action around language access. The interpretation that we used was what you might consider ad hoc. People would be using friends, family members, relatives, informal community interpreters who had varying degrees of training, if any training, definitely not being paid for this. It was a sort of, volunteer community service type thing. We did know enough at that time not to be using children, but we weren't too far more advanced beyond that. A lot of the work I was doing was with cultures that use languages of lesser diffusion, so less commonly spoken languages in the United States. And sometimes we even had to use what's considered relay interpretation, where somebody would be speaking a language that was spoken by just a very small number of speakers, maybe even in the country that the person was coming from. And to get to the interpretation, we might have to go through two different people to get to somebody who could speak that language. So that was just a really interesting early exposure into language access. After working in North Carolina, I worked overseas in refugee resettlement, doing refugee processing. We did work with paid interpreters, but again, it was the level of training wasn't necessarily known to us as the professionals working with the interpreters. And my understanding was that the biggest qualifier was being bilingual versus any specific kind of training. When I moved to Maryland, though, and was working for the state health department, I became more familiar with the legal requirements around language access and the notion of professional training for interpreters. This was really eye-opening, considering I'd worked in this field at this point 7-8 years and hadn't really been exposed to the idea of professional interpreting. And it put into context what I'd experienced earlier in my career. I also had the privilege of working with professionals who were passionate about language access. So not only was I being exposed to the legal requirements, I was meeting people who were really passionate about policy and advocacy work and who were able to educate me about the legal and ethical requirements around language access and introduced me to the training both for providers who would be using interpreters, as well as training for interpreters and the different requirements for interpreters. So all of that came together to really ignite this passion in me of having been in those situations where people were less knowledgeable about the requirements around language access to being in a setting where it was just sort of the norm.
Yes, and I am so glad that that passion was ignited in you because that's how we became friends. You and I were the only two recipients from the School of Social Work at the University of Maryland that earned the privilege to write a white paper on cultural competence. Remember that, Amy?
Yes.
We had a really wonderful experience, or at least, I mean, I'm not trying to speak for you, but I know that our experience was very enriching with professionals from other backgrounds. Can you tell our listeners how do you see back then the connection between language access and cultural competency, and what can we learn about this connection?
I'm so glad you brought that experience up, Carol, because I think one of the key aspects of it, you mentioned we were two social workers involved. The other folks involved were all from other professional disciplines. So there was people from the law school, from the dental school, from the medical school, from the nursing school. So it was pharmacy. So it was this kind of meeting of the minds from these different professional backgrounds, which I think made it a really strong program that we participated in, as well as the resulting white paper that we had written together. And I think in terms of cultural competence and language access, I think one of the important first step is unpacking the term cultural competence. I think it's often understood to represent the idea that somehow someone could become competent in another culture that's different from their own. However, one of the things Carol and I kind of worked towards in this program was an understanding that cultural competence is an umbrella term that encompasses all of the different approaches of working cross-culturally. So you work towards competence and skills, approaches, tools for bridging culture, not full competence in another culture. So I think that was really one thing out of that program that was really helpful for me, because I think sometimes that term cultural competence, there can be this pushback of like, well, you're not going to become competent in another culture, which I fully agree with that. You'll never become competent fully understanding a culture and immersing yourself in a culture outside of your own. You can learn from others. You can learn about culture. But to fully expect any human being to become 100% competent in another culture, I think is a pretty big lift and ask that I just don't think is feasible. But we can become competent in is skills and tools for bridging culture and understanding one another across cultures. And what that means for language access is that ensuring full, clear communication through the use of interpretation, translation, bilingual workers as one part of cross-cultural work. So one of those tools of cultural competence is using language access for understanding. Language and communication are at the core of cultures. How we communicate is core. So ensuring language access is a key part of cultural competence.
I am remembering when we were introduced to the talk of cultural competency and how much we learned, and how a definition of that term really helped us move forward with our paper. I think what's fascinating to me is how people have tried to define the exercise of really understanding another person's being, another person's culture, and really interacting in a more conscious way. So we have called it many, many things: cultural competency, cultural awareness, a plethora of terms today that exist to describe that, our interaction. Thank you, Amy.
Yeah.
So you work in the mental health space. In fact, you head an organization that provides mental health services. Can you briefly describe what your organization does, whether you have a language access plan, and whether or not you have multilingual communities or you work with multilingual communities?
Sure thing. Our whole purpose as an organization is increasing access to mental health care. And we do that by providing outreach and education and stigma reduction. We also provide mental health navigation support to help people find a mental health professional or mental health service that's appropriate to their needs. And then we connect people who are having difficulty accessing licensed mental health, people who are having difficulty accessing care to licensed mental health professionals who volunteer their time. Every year, a few thousand Marylanders receive over 10,000 hours of free counseling care. And we also offer a mental health warm line, and folks can call to talk directly to a mental health professional for free phone-based support. And then in terms of a language access plan, Carol, I've learned a lot about this through our work together. We do have bilingual staff. So when you call us, you can generally speak to somebody who we have staff who speak Spanish as well as other languages. And all of our staff are trained in connecting limited English proficient callers to either those bilingual staff or connecting to phone interpretation. When we match clients to clinicians, we are first looking for bilingual volunteers who speak the caller's primary language. Sometimes that's not feasible just based on the numbers of people calling in, availability, the type of need that somebody has. So if that's the case, we'll use interpretation. And Carol, we've worked with your organization to provide that interpretation. And we train our volunteer mental health professionals in providing therapy via interpretation. And again, Carol, that's a service you've helped us with, those trainings for to prepare our providers to work with interpreters. We also work with interpreters who are trained to work with people who have experienced trauma. So we know that that's a really key part of making sure the interpreters are prepared for what they'll be dealing with in mental health. And we also use professional translation services for documents. Again, Carol, that's something that you've assisted with us, including parts of our website to make sure that our website is professionally translated rather than relying on something like a Google Translate. We want to make sure that we're using professional translators. And then in terms of the community that we're serving, about 10% of our clients speak a primary language other than English. We have 2 initiatives that speak directly to the needs of these clients. We have terapias for Spanish speakers and chai for South Asians. And in addition to these initiatives, we work with speakers of languages from across the globe. So while Spanish is our most common language, we work with folks who speak all the languages that we have represented here in Maryland.
Amy, I think your organization is perhaps one of the most accessible in terms of language, at least in healthcare, or at least that has been my assessment based on the organizations I work with. And I really commend you for that. And thanks for your kind words about our work together. I think we as a company have grown thanks to clients like you as well that have a vision for language access and a vision for including multilingual communities. So I admire the work that you have done also in the multilingual space. And let me ask you, has that made any difference in terms of the growth of your organization offering language access?
Oh, for sure, 100%. When I first started, Spanish speakers made up about, I would just say, Latino folks in general, whether Spanish was their primary language or they were folks who were maybe second or third generation and spoke English as a primary language. Latino folks made up about 10% of our clients, and now it's 20%. And so we've seen just that growth specifically in the Latino population, but also in other language needs. And one thing that really attracted me to the organization's been around 30 years, and I joined the organization just about 6 years ago. And one thing that really attracted me to the organization is there was already this base around we serve everyone in Maryland, and we're thinking about the needs of LEP folks. And so it seemed like an organization that I could grow with and could bring the background I had with refugee and immigrant services to an organization that was already thinking about it. So we doubled down on work that was already being done. And that was just really great to join an organization that already had that view. I think that one of the things that I've observed over the years, particularly coming from a refugee background, is that it's almost like there's services that predominantly serve English speakers, and then there's services that predominantly serve Spanish speakers and speakers of other languages. And there's very few, as you said, organizations that are able to serve both well. And that's something that we've really positioned ourselves at as, yes, we are here for everyone in Maryland. If you speak English, we work with you and provide you good counseling services. And if you speak another language, we are able to do that as well. And so I think that it can be looked to as a model of how you can serve both populations well. Because I think that there's a role for organizations that really specialize in particular populations, but we're losing something if we're saying that our immigrant populations and our LAP populations can only access those services that are focused solely on their population needs. So I think that organizations that predominantly serve English speakers should also be doing language access to expand their reach.
Yes, that is sort of our vision and mission for Equal Access Language Services, is to help businesses understand the potential they have with the inclusion of language access as part of their daily operations. And Amy mentioned an acronym. LEP stands for Limited English Proficient. And we are going to talk a lot about limited English proficiency. We already talked about in previous podcasts, but this is just a reminder that that's what it means. So when it comes to language diversity, what kinds of challenges do you face when trying to provide language access services for these communities?
Yeah, so the primary language that we work with is Spanish, and we have multiple volunteers, mental health professionals that we work with who are bilingual in English and Spanish, but it's just not enough for the population we're serving. And in Maryland, we also have a host of other languages that are spoken. We're a bit of a United Nations here in Maryland, representing the global community. And we also have limited providers who are bilingual in languages beyond Spanish. So we have what we consider a considerable number of Spanish speakers. Could always use more, but we also could use more mental health professionals who are bilingual in additional languages. And some challenges, which I always see challenges as opportunities. So I try not to use the word challenge without thinking of what the opportunity is there. But some challenges that I think that we could address our recertification options for people who received training in another language. So when people who first received a degree in, say, social work, psychology, professional counseling in another country and have moved to the United States, that's a whole group of people that we're missing out on joining our workforce. And so if we can find pathways to recertification, that would address that challenge of the limited workforce. There's people already here among us who have that training and background. We should find ways to do recertification. Another area that I think is a challenge and an opportunity is we don't actually know how many bilingual providers we have. The licensing boards could begin tracking at the time that people achieve their licensure, ask if people's level of fluency in another language, so that we know the size of the bilingual pool of providers. A lot of it's kind of guesswork at this point and using proxy measures. Another challenge is getting folks to enroll in mental health training programs. So the opportunity would be to provide scholarships, stipends, outreach, education, so people know about these career pathways and are supported in pursuing them. And I think this is a really cool program that I try to talk about every chance I get. There are educational programs that support people who are already bilingual and those who are learning a second language like Spanish in pursuing a mental health degree. So out in Colorado, there's a program that's a master's in social work that people can achieve their master's degree through a Spanish language immersion master's program. So I think that there's innovative models out there looking to address this. And I think here in Maryland, we could look to do that. So I think that the biggest challenge is the workforce development so that we are able to have a workforce that's prepared for the multilingual population.
Amy, I love the fact that you say a challenge is an opportunity. And that's precisely what we want to underscore here is that language access should be approached as an opportunity to expansion, inclusion. In many ways, it is seen as an expense, as something that business have a burden to do. But they miss out on the opportunities to reach a new type of population, to perhaps client base, depending on what kind of business do you do, or if you're in an organization. So they miss out on that because they can only see it as a challenge and not as an opportunity. So I think it's a wonderful invitation to people and to businesses that they start perceiving language access more as an opportunity than as a challenge or a difficulty or a barrier of some kind. Another comment you made was about bilingualism and developing into these professions and how important it is. And I think in the advocacy world, one of the things that are happening, at least in the language advocacy groups, is that they are trying to teach children, or to teach our legislators rather, how important it is to invest in children and in students to learn a second language so that when they graduate from high school, they are bilingual already, because that helps them be a more effective professional with populations that are limited English proficient.
Yes. Yeah, I think that's so important. And one of the things that we've seen, I've actually in interviewing, I've changed how I phrase this question. So we see people who are bilingual who maybe came to the United States as young children and grew up in a family that spoke a language other than English. Sometimes it's Spanish, sometimes it's French, sometimes it's Chinese. And so they grew up speaking what you might consider kitchen language, just home language. But they never went to school in that language, or if they did, maybe they moved in the first grade, second grade to the United States. So they had a very basic primary education in that language, but they never learned professional ways of speaking. And so they just speak the conversational things that you would talk about within your household. So most of us are not across cultures. We are not generally talking a lot about depression, anxiety, hallucination, emotions at home. Sometimes we will, but we might talk more about stress or worries. And so, or we might talk in more casual language. And so when we have staff members or interns in these situations, and we first ask like, oh yeah, so in an interview, we might ask, do you have capacity in another language? Then we ask, would you be comfortable to do an intake, a mental health intake? And at that point, usually folks will say, oh, I just don't have that vocabulary. So we've had people who are very much fluent in a language other than English, but they still engage an interpreter for the when they're doing the intake appointments, because they know that their vocabulary isn't strong with the mental health terminology that might be coming up. And also, so I just think that that's just a really interesting, to your point of promoting bilingual education. We already have people living amongst us in our communities who have just a vocabulary that needs to be built upon. And so if we were to support bilingual education, some of these folks who are coming with a baseline knowledge might then become those professionals of tomorrow. So that's something that I've just become aware of, is that bridge between a basic level of understanding of a language to being able to perform a specific healthcare related task and having the correct vocabulary. So that's why I brought up that idea of like a bilingual social work program. Then you would be gaining the vocabulary of social work in your language, in your second language or first language, depending on which direction it was that you were learning, say Spanish or whatever the other language is. So I just think that that's a really important piece of that, is recognizing that we often don't promote bilingualism in this country.
Yes. So a couple of things that are really relevant in this conversation about bilingualism is that when people come to this country, if they come with their families, there are some immigrants that underscore the English language, and they want their children to forget about their language because of trauma or for many reasons. They don't want them to speak the language of their country. And they want them to perhaps adapt to this culture better, and they are concerned about their learning English. And if they knew how much of an opportunity it is to have a second language, and if they understood that that is precisely the added value that they have, is that language, that first language that they are trying to erase is actually what's going to allow them to have a very, very good asset when they become professionals. And the other thing is that proficiency is something that people don't take into the consideration when they are hiring a bilingual person, right?
Yep.
And as you say, when you are growing up learning a language, you might learn the kitchen language, but you might not be proficient in different realms of the language, right? You might not know all the terminology for healthcare or law. And even I, as an interpreter, will have to prepare every time I go to a new assignment where I don't know the vocabulary, right? So I think that is a really important point, that organizations and companies need to understand that proficiency is something that has to be tested. So if people are going to be providing services as bilingual personnel, the standard should be that they are tested, right?
How often have we seen this? The receptionist, the nurse, she speaks Spanish, have her do this. And maybe they're even asking that person to do something either that's outside of their language set or their professional set. Like either side of it, you sometimes see this with, this person speaks Spanish, so they should be able to do this task without really thinking about what their, whether the task being asked is within their skill or within their vocabulary. Just because this person speaks whatever language you're looking for, they sort of become the sub-in for the professional, that they're being asked to interpret for, or to communicate at a level that's different from what their, like you said, their proficiency is. And so, if people aren't familiar with this, they might not consider that proficiency assessment.
Yes. Well, Amy, can you speak to the issues of reimbursement in mental health for interpreters? Are there any differences between reimbursing healthcare services versus mental health services?
Yeah, under the current medical assistance or Medicaid program, and this is specific to Maryland, interpretation isn't reimbursed for either healthcare or mental health care. And this creates a problem, because if someone is seeking care who has medical assistance and the provider accepts medical assistance, the legal situation is that provider has to provide the interpretation, and they have to pay for it. They can't legally or ethically pass that cost on to the patient. And what can happen is the interpretation cost might cost, depending on the circumstances, 3 to 4 times what they're being reimbursed to provide the service. So they end up paying, they're losing money on that appointment. And so what that's resulted in is, well, first of all, many folks just aren't even aware of these requirements. And then if they are, they might say, why would I get into that? I'm losing money. I'm having to pay the interpreter more than I'm being reimbursed. So that's a big problem, particularly for folks in private practice. Some states have accessed federal matching funds to fix that problem. So if this is something folks are passionate about, this is something that there's room for advocacy around, is advocating for Maryland to tap into the federal matching funds so that we can start reimbursing for interpretation for both healthcare and mental health care.
Yes, I think we should do an entire podcast
Yes.
in advocating for reimbursement in interpreting for mental health settings.
Yeah.
Let's talk about compliance. What are the key elements a mental health facility should do in order to be compliant with language access laws or with the Americans with Disabilities Act, ADA?
Yeah, I think the first step is awareness of the requirements. Many facilities and folks in private practice might not be aware of what those mandates are and what they're required. And again, thinking of these things as both legal and ethical areas, because I think that sometimes we get caught up in the legal aspects. And so for ADA, for example, there's certain things with ADA that might click in based on the size of the number of employees you have. So I think I don't want to misspeak on a recording, but I think that it's like 15 employees that a lot of this stuff clicks in at. And so you don't want to be saying, well, I have 13 employees, so that doesn't concern me. Well, there's a lot within the ADA that maybe just to be a good health provider, we should be looking at. So I would just encourage folks to think about what's the spirit behind these rules and regulations, even if I'm not being held to them 100% because of the size or the age of my facility, et cetera. What can I be doing to be more inclusive and more accessible for, again, thinking of ADA and language access. And so being aware of the requirements, regardless of your size and scope of the organization. And then I think what you need to do is look at what those requirements are and budget for them. Think about what the costs involved are in the same way you would budget for any other cost of doing business. And you then need to train and educate the staff. Your staff need to be on board with this. So this involves both a culture shift and staff training on the mechanics of using interpreters, how to access interpretation, and all of those mechanical aspects of language access. But there's also, as I mentioned, organizational culture. The staff have to buy into the necessity and imperative of language access. If they don't fully connect to the importance of language access, they won't use the services. We've all seen this. I think if you've accessed healthcare and you've been around a service where somebody who speaks a language other than English is trying to use the service, you have seen people brush that person off, set them to the side, not really engage, maybe use a child as an interpreter, all of these things. Many of us have borne witness to this. And so it takes a cultural shift for folks to buy into the necessity and fully use these services. So I just think of when you're thinking of acceptance of this, there's both the training in how do I get the phone interpreter on? How do I request the interpreter from our interpreter program? All of those logistics. How do I position myself and how do I speak in the first person to then communicate directly to the person seeking care? There's all of that, but there's also the cultural shift that has to happen. And I think that one part of that is helping staff realize that this is just a core part of healthcare. It's as important as wearing gloves, washing hands, and all of those other things we think is very basic requirements of healthcare that at some point we had to shift minds to adopt, but now it's just second nature to do those things.
Cultural shift. What an important concept. And that's precisely what we're aiming to do with a podcast on language access. We definitely want to promote this cultural shift around language and language access. So thank you for reminding us how that can be done once we understand the importance of this and associated just as a patient safety procedure like washing hands or anything that to prevent infection. It is just as important. Amy, talk to me a bit about patients that were deaf and hard of hearing and patients with limited English proficiency. Were there different standards or expectations around the service to each of the populations? What differences, if any, did you find from the patient population?
Yeah, so one thing I've noticed is that there tends to be more of a widespread understanding among both the deaf and hard of hearing communities and the hearing communities of the use of ASL interpreters and the need for these services. There's been a much longer history of advocacy. So I think just in general, there's a greater baseline understanding across the United States about these needs. I'm not saying that it's perfect. I'm not saying that there's not still work to be done. I'm also not saying that there's not still struggles within the deaf and hard of hearing communities for equal access to care. But there's just been a lengthier history of the disability rights movement, including advocacy and a baseline understanding within those communities of what their rights are. Again, not to say that that's universal, but that there is just a wider spread advocacy and education. And I also think that there's a feeling in the general population of just that the cause for hearing loss is rooted in a health condition. So that I think might elicit, just again, thinking very generally, might be more prone towards sympathy and understanding. And I think there can sometimes be stigma if somebody's reason for needing language access is rooted in immigration, because that's maybe seen more in an optional light. Again, I come from a refugee background, so understanding that there are forced migrants and economic reasons are reasons that people make immigration choices. So there's lots of complications to this, but just thinking across the general population, I think the understanding that the root of an issue is health might elicit more understanding and sympathy than something that is often understood a framework of choice. Somebody chose to come here, and so they have put themselves in this situation. Again, I think that that's a problematic understanding, but I think that's what is generally across the population, just a baseline belief. And so people's feelings about immigration policy and just immigration in general get tied up in how they view these things. And so I just think that all of that plays into differing feelings around providing folks with ASL interpretation versus providing foreign language access.
What do you think is the role of technology in language access as it applies to mental health? Do you use technology such as video remote interpreting or telephonic interpreting, Zoom, etc., for language access? Have language access services improved because of technology? And what has been your experience around this?
So our organization has always used telephonic interpretation from when we began using thinking about language access. Because the initial contact that our staff all have with folks seeking care is over the phone. So we, again, have bilingual staff, but we also have telephone interpretation access. And then if people were receiving language services during the counseling sessions, it would be either telephone-based interpreting or in-person interpreting that they would get. But then when the pandemic hit, teletherapy really picks up. So we added in remote and video interpreting because the therapy sessions were happening over video-based conferencing using secure teletherapy platforms that were HIPAA compliant. And not only was this a necessity, but it also worked really well. It's worked really well in terms of access for folks. Especially, you can get the benefits of an in-person interpreter without the cost and the kind of hassle associated with travel, with getting all three of these people to the same place at the same time: the interpreter, the client, and the provider. And really, I see all of these things, all these aspects of technology as tools to increase access to mental health care. One thing that I've noticed that I think might be of interest to your listeners is that often telephone interpreting is presented as sort of the lesser option. And it's sort of, I think, the ranking that I often see people say, gold standard is an in-person interpreter. If that's not possible, doing a video-based interpreter. And if that's not possible, last resort, use the telephone-based interpreter. And I just want to put a plug in for telephone-based interpreting, particularly for smaller organizations with limited budgets. It's a much more cost-effective way to provide services. And the other side is on the mental health side. One of the things we've noticed is some people actually prefer a phone interpreter when they're in a mental health session because they're already have that situation of where they're sharing something that's traumatic that's happened to them. Often they're speaking to a counselor who they're seeing face to face, and adding a third physical person to the room can sometimes just add to the re-traumatization. And some people, especially if you're coming from a language group, one of these languages of lesser diffusion, where there's very few interpreters available in your area that speaks your language, this same interpreter might have seen you for court appointments, maybe your kid's dental appointment, other kinds of appointments. And so if they're now also your interpreter for mental health, that can be difficult for folks. So having somebody who maybe is a bit removed geographically, who you don't know, who's maybe more of a the term we often use is the black box, the model of just the disembodied voice in the phone, that can actually serve a therapeutic need for the client, where they don't have that added layer of somebody that they might somehow have a connection to already because they come from a small community in the room. So I think that I think often we see technology as sort of a band-aid, but I think in many cases it actually provides the better choice for some situations.
I think that is such a great point about the privacy and how the telephonic interpretation may help with privacy and may helping a patient feel less seen by a third party that has nothing to do with their case. It also helps with the rapport that the practitioner might or the um, mental health professional might create with the patient. I think is a very, very important point to underscore. And I do see that people tend to prefer telephonic interpretation last, like they want to use that as a last resort without keeping into consideration that actually make their patients feel more comfortable. And speaking of privacy, what concerns do you have with technology around this? You mentioned HIPAA compliant platforms. Can you expand a little bit on that with regards to technology?
So I think that just something that often people might look past is the same restrictions around confidentiality, around privacy that would be in place if a counseling session were taking place in person in a counselor's office. All of those same restrictions apply online. And so the therapist is still bound to confidentiality. The interpreter still bound to confidentiality. The platform, as you mentioned, does need to be HIPAA compliant. And really that involves with how the material is distributed across the internet. It should be encrypted. It should have password access. And there's different kind of checkbox that has to meet. So you wouldn't just be using like FaceTime or something. It's got to have more restrictions than. And even while Zoom makes HIPAA compliant version that's a bit more secure than the standard Zoom that you're using for business meetings or your neighborhood happy hour or what have you. So those are just some things of the technology needs to be HIPAA compliant. And as I mentioned, interpreters are bound to confidentiality. And I think it's the kind of situation that if everyone involved is aware of the risks and practicing risk management, it can be just as secure as in person. And the flip side of that is if people are being, loosey-goosey around these restrictions, then the same risks apply to in person. So it goes both ways of there's risk with any kind of situation, and it's being aware of what the restrictions, what the legal requirements are, checking to make sure those are in place and making sure everybody's aware of what the restrictions are and are practicing risk management.
And you underscored training, how important it is training for everything, risk management and operations. Let's talk about training since you underscored training in different aspects of your operations and risk management. And you have been one of Equal Access Language Services' most faithful clients. And we have collaborated with you in several projects, including translation. But one product that we have been blessed to use with your organization is our signature training, Effective Inclusion Through Language Access. Can you talk to our listeners about the impact of this training in the culture of your organization?
Sure. So I think that regular training is really important to developing a culture where language access becomes second nature. So when you have people who are regularly trained and this is just part of their work and it's an expectation, there's no question about it. Doing training lets stakeholders know that it's something that's important to your organization, and it increases client trust in your service because you can say people have been trained. So it's not just we're making this up as we go along. We've worked with a trusted partner. We've worked with Equal Access Language Services, so folks know the brand name of the training that we're doing. And it addresses the needs of clinicians. Our clinicians will sometimes tell us, I'd love to work with LEP clients, but I don't have the training. This is not something that people generally get in health training and mental health training and school programs. And so what we strive to do is offer at least one training per year. And now we have over 100 clinicians who we consider interpreter ready, in addition to 80 plus bilingual clinicians. So it just adds to the pool of people who can work with the limited English proficient clientele that we have. So we've just been really grateful, Carol, to work with you on these trainings and for the services you've been able to provide. And the clinicians all speak very highly of the training that they've gotten through the programs you've offered us.
Well, thank you, Amy. I think it has been a mutual learning process. And one thing I want to also emphasize is that the training is approved for continued education for clinicians and social workers. Is that right?
Yep. So we have it. We've gotten it approved for continuing education for social workers as well as professional counselors and psychologists too. So we're able to offer it as part of their professional development.
Yeah, and I think this is perhaps the element of our company that we feel the most proud of is effective inclusion through language access, because it really allow us to offer to the client that change of culture on around language access and change of behaviors with the clients that they have that are limited English proficient. So we believe that the impact of such training it really is far beyond original expectations. As you know from the many hours of conversation you and I have around the topic of language access, is my desire to change the culture around language access, and my thought that language access is a key component of the concept of diversity, equity, and inclusion. What are your thoughts with regards to this combination? And do you have any ideas on how to create fellowship and partnerships with professionals working on that space?
Yeah, I fully agree. I think that language access aligns with DEI values and the work of DEI professionals and can and should be included in diversity, equity, and inclusion work. I think in terms of fellowship and partnership, you'd be looking to connect with people who are leaders in this space, people who are DEI consultants, and people who are organizational DEI leaders. And I think that the way you connect with folks is maybe attending conferences, networking events for where these folks would gather, maintaining an active presence on social media. I think that a lot of the folks doing this work are very active on social media. And so participating in those conversations on LinkedIn and Twitter and all of those good things. And also, I think writing in this topic may be a way to create fellowship and connect with other professionals. So I really think that it's all about connecting with folks in that space. And I think that DEI can be such a broad topic, and that adding the voice of language access into it is really important.
Yes, I have observed that DEI is often very inward oriented. The focus is more on how to create the right environment to work in, right?
Mm.
But language access, since it is like an external component of sorts, it is more difficult to integrate. And that is a sort of the challenge slash opportunity that we have found, is that we really think that if DI initiatives turn their view to being more inclusive of the populations they actually work with, in addition to, of course, being more inclusive of their workforce, maybe we can see a broader change in our
Yeah.
culture.
That's a really interesting point, because I do think that a lot of DEI initiatives do end up kind of housed within HR functions, which then leads to what you're describing. And then also thinking of my experiences more on the nonprofit side, and then specifically nonprofit social services and health services, where DEI work is thinking about how do we do this work to the impact of the client. And so that's definitely centered in the DEI initiatives that I've been a part of, but I could definitely see if it's more of a for-profit business side and those kinds of initiatives are housed under HR, then it could get more centered into the workplace culture. So I think that's just an interesting, I think it might depend on what type of a company, what type of an organization, and what their mission is, and what they're looking to affect change in through their work, that you might find different approaches. So that's a really interesting point.
Yeah, I did a certificate program on diversity, equity, and inclusion, and noticed that it was very oriented to, it was very much a function of HR, as you say. But I think that things are changing, and we want to be part of that, of promoting that change. What is the role of the limited English proficient person, or the person with limited English proficiency, in improving language access services in mental health? If you were to tell them something, what would you tell them?
I think this is such an interesting question because I think in an ideal world, in our perfect world, that person who needs language access should just have to say something like need interpreter and the name of the language that they speak. They shouldn't have much more of a role beyond just the very basics of communicating what they need. And maybe an understanding that they should just stay on the line while the staff person gets an interpreter, right? Because there's a sort of bridging moment where if the person calling is speaking to somebody who knows no words in the language of that person, there needs to be sort of a trust there, right? That this person's going to go off the line, get an interpreter, and pop back on. So there needs to be some sort of understanding of the person seeking the care that this is the general process, to just hold on the line while an interpreter is being connected. Unfortunately, in many situations, that person is going to need to do more to advocate for what they're legally entitled to. And so I think if someone is interested in improving language access, they should become informed of their rights, become informed of the areas of law that have to do with language access, maybe have a way to convey their rights to the staff they are interacting with. So if it's an in-person appointment, maybe having a wallet-sized card that says, and I need an interpreter in X language with a reference to the parts of the law and policy that protect language access, that sort of puts that organization on notice. Like, this isn't just, me requesting this because it's, some whim of mine. This is a legal thing that I'm entitled to. And then also, I think when people see language access violations, understanding that they can report those to the institution through grievance policies or an ombudsman, if there's an ombudsman that the organization has, and working with their elected officials or working through coalitions. Sometimes immigration status is tied up, and so people might be cautious to make themselves too known, but working within a coalition can be a way to do that in a more safe way to raise their voice. So I think those are just some of in an ideal world, that person should just be able to say, I need an interpreter, and name the language, and then everything falls into place. But we know that's not what's happening. So I think those are some things that folks can do.
Yes, it sounds like you want to point out that the onus shouldn't be on them, that we should all sort of know how language access works. And I agree with that. I think that it should be a second nature, as we said earlier. And one thing that Amy mentions here is that you can first know your rights, and also if your rights are violated because you don't have language access, you can place a complaint. And there are safe ways to do it. Amy provided a few options. And remember that option that we discussed in our first podcast about lep.gov, where if you suspect that there is a Title VI civil rights violation and associated with language access, you can also anonymously complain on this website. So there are many different options to place complaints around language access or the need for language access when they are not being fulfilled. Amy, in your opinion, what are the most significant pitfalls in language access today? If you were to use a magic wand, what would you resolve?
Yeah, I think the most significant pitfall is the lack of education and understanding from professionals that can lead to misguided practice. So when you don't have that baseline understanding, you end up doing things like using children, using family members, not going through official channels, using untrained interpreters. And so just education and understanding, I think, are really key. And if I could wave a magic wand, it would be to ensure that all medical institutions fully implement the class standards and have full funding to continue carrying out all aspects of the standards.
Great point. Class standards, something we will talk about in our podcast. They stand for culturally and linguistically appropriate services. And we need to dedicate at least one entire episode to class.
Yes.
Right?
And I think it's a lot. I don't know. As I was, full disclosure, Carol had given me these questions in advance. And as I wrote that out, I was thinking, if I have a magic wand, I should dream bigger than the government's minimum standard. But even though that is a minimum standard, they're really encompassing of what should be done. And I think that in terms of a starting point, if we can get everybody up to that point, then we can dream even bigger. But until we get everybody up to that standard, then it's really hard to even envision what a future could look like beyond class.
I think that's true. I think they encompass everything that we can possibly imagine can happen in language access. I think they're very comprehensive. And you mentioned, for example, the idea of using children for interpretation, and it is such a pervasive practice. I just was at a conference hearing an experienced attorney, very successful attorney, talking about how they had taken care of the language barrier because the client would come with their child who spoke also English and would help them sign documents, legal documents,
Oh
mind
my
you.
goodness.
And my heart just broke a little bit. So this is one of the challenges that I want to turn into an
Yeah.
opportunity. But there is a lot of there is this attitude of, oh yeah, we have the language barrier figured out because clients come with their 11-year-olds that are going to help them sign a contract. And I always wonder, how would you feel like if you were in another country trying to sign any legally binding document, having an infant, well, not an infant, but a minor child helping you sign that document? Wouldn't you feel a little bit uneasy about the stakes and the language service provided? What
Yeah.
were you
Yeah.
going to say? I
Oh,
interrupted
I
you.
was just going to say, I think what you're speaking to, though, this person's willingness to just announce that at a conference really speaks to my point about lack of education. If people had a better understanding. So there's one thing to do something like that and kind of know that it's not the right thing, and you probably wouldn't announce it at a conference. But the education level on what the ethics and responsibilities and right practice are it's just so not part of our standard vocabulary, standard training, that somebody can feel comfortable. Somebody who's a lawyer, like most lawyers I know, are very careful about what they say in public to not somehow, make themselves look bad or make themselves look like they're doing, poor practice. And so I think that just speaks to just how much work there needs to be done around education, that somebody could just announce that at as a conference as a potential solution to language access. Of course, just use the kids. That's why would we think about doing anything else? That somebody feels that comfortable to say that speaks to that lack of education. So
Well,
lots of work to be done.
yeah, another reason why I'm doing this podcast is because I recently discovered how the expression language access is not something people are familiar with. So the two words exist in the English language, but when I ask a company or a potential client, do you have a language access plan? They give me a blank stare. So
Mm,
I became aware very recently that language access is not something people use in the regular vocabulary. So
mm-hmm.
there is a lot of work to do, and again, it's an opportunity more than a challenge. So that is part of the purposes of this podcast, is to educate people on what it means to have a language access plan and what it is language access, what's the definition, and we have talked about that in previous podcasts as well. For smaller organizations or facilities dedicated to healthcare and that don't have large budgets, because you were talking earlier about how important it is to plan for language access and to include it in the budget, what would you recommend they do to implement successful language access plans?
Yeah, so I think that some ways that smaller organizations, because we have a small budget, we're a small organization. While we have a large reach, we're doing it kind of on a shoestring. And one way we achieve this is working with partners and also including language access in all grant budgets and fully understanding the cost, because it can seem daunting at first, but when you really start looking at how many people you're serving and what you need, you might find it to be more affordable than you realize. So just first understanding the cost rather than kind of being the ostrich sticking your head in the sand and just ignoring it. And through partners, you might get access to some things like group buying of language access services that can reduce the costs. In Maryland, nonprofits can access the state contracted rates for interpretation and translation. So that's a way to bring it to be more affordable. And then we also receive a state grant that allows us to partner with another organization for free interpretation specific to victims of crime. And so just knowing there might be some opportunities like that you'd only find out through networking and working with partners. So I think just asking similarly sized organizations or organizations who you admire what they're doing around language access. How are you doing it? How are you paying for it? Hiring bilingual staff is another way to go, depending on what your needs are. And again, as Carol mentioned earlier, if you're hiring bilingual staff, assessing for proficiency and also proficiency in the specific vocabulary area that you're working in. And just understanding that just having an awareness of budgeting and fundraising and issues around language access are knowable and achievable. And what I mean by that is sometimes it becomes a sort of like, oh my gosh, how could we ever achieve it? It's outside of our reach. I don't even know where to begin. You can find out what the costs are. You can find out what your average number of clients served who speak another language, how many hours of service they need, what the costs are. And so then you can work backwards from there. So really approaching it as you would any other cost problem will help you get a solid plan in place.
And that would solve the issue of having to get into a situation where you are asking for volunteers who do this and that. Nothing wrong with volunteerism. I am a full supporter of volunteering. But I think that is a measure that's often taken when you haven't planned. Oh, let's have people volunteer. Whereas if you have planned, or if you have a plan for language access, then you can hire professionals as opposed to having to rely on people volunteering that may or may not be qualified to do the job.
Yes. Yeah. As even as the leader of an organization that relies on volunteers, I fully support that. I think that it's a professional service that should be paid for. And if somebody is willing to volunteer, like you said, making sure that they're proficient, that they're reliable, and that they've been trained appropriately.
Exactly. It's not like because you're a volunteer, then less is demanded of you. You have to have the appropriate level of performance to do a volunteer, to do any kind of volunteer work. So your volunteers, I'm sure they are professionals.
Yes, ours are professional. We check their licenses, we talk to them about their training and credentials and all of that. So we're vetting them. And so I think sometimes too, sometimes folks are saying, oh, volunteers and not checking into those things. So I don't want to say there's not a role for volunteers, but that shouldn't be the primary way of addressing this issue. I think
right,
it could be one possible way. There's multiple ways of addressing this, and one possible way could be. But if you're going to go that route, just understanding that it's a profession, and in the same way that you would vet any other type of professional, you can vet a professional interpreter.
And I think that's the key is the idea that interpreting is a profession. Translation is a profession. And even though professional interpreters and translators can volunteer, when we plan any kind of event where we are requiring language access, first budget for it and then, think about volunteerism for that. But when you do need volunteers, vet them and make sure that they are qualified to do the job.
Yes.
Excellent point. As you know, Amy, I head a language company, and perhaps, so I hope many of our listeners are also language business owners or perhaps self employed interpreters or translators. Your perspective as an ideal client is incredibly valuable. What kinds of things did you value from your language services providers like us, or what do you think we can keep doing well? And what kinds of things you wish we or any language company could offer you?
The things that I would encourage you to keep doing well and that we've really appreciated working with you is really good project management and responsiveness. I just love working with vendors who are responsive and understand project management. It just makes the engagements go smoothly. It seems like when those areas are lacking with a vendor, that's when kind of the wheels come off the cart, so to speak. And so we just really appreciate working with you because you understand both of those things, project management, and you're very responsive, easy to get in touch with. We always know where we stand with the project, where things are going, et cetera. So those are the areas that we really appreciate working with you. And I'll have to think about what kinds of things you wish that you could offer us. At this point, we've really appreciated working with you for training, for interpretation, for translation. And so I think that just keeping up with those things, and if we think of anything else, we will definitely, I know where to find you.
Thank you, Amy. I am glad that you mentioned project management and the services that we provide. And the reason why I asked this question is primarily because we do want to add a value to our clients. We want to be the expert on language access so that they don't have to think about that. So we don't see ourselves as just like a translation company or an interpretation company, but more of a language access company. And that's why we focus on project management, especially with all the technology that's coming out, that anybody can use technology for translation or even for interpretation. But you need someone who knows what they're doing in the field of language access to really provide what you need and bridge the gap, the language access gap. So we are focusing more in project management than just individual services. Obviously, those individual services are part of the project management, but that's exactly where we think our strengths are. But we want to hear from our clients if that's of benefit to them, because we are also in this journey of exploration around language access as well, and learning a lot from our clients. So thank you for being completely open and honest about that, Amy. Is there anything you would want me to ask that I didn't ask?
Just that if folks are looking to learn more about Pro Bono Counseling or to support our work, they can visit our website. That's probonocounseling.org. And we're also on social media at Facebook and LinkedIn and Instagram, and all of those, it's at Pro Bono Counseling. So I just would love to connect with anybody in your audience who's interested in learning more. They can contact us through those venues. So just looking forward to continuing to work together, Carol, and connecting with your audience.
Thank you so much, Amy. It was a pleasure to have you here in our podcast. And yes, have a wonderful day. Thank you.
Thank you. Thank you for having me.
And that wraps up another enlightening episode of Language Access Matters. We hope you have enjoyed our discussion on the profound impact language access has across various sectors of society. Let's remember that language access is not just an isolated topic. It intertwines with various fields, impacting lives and businesses in profound ways. As we continue this journey together into becoming a more inclusive society where we ensure equal access to services to those who don't speak the dominant language, we want to assure you that our company, Equal Access Language Services, through its podcast Language Access Matters, will be with you every step of the way. We are committed to bringing you thought-provoking conversations, expert opinions, and stories from the field and beyond. To dive deep into the subject matter and engage with leading experts in the field, we will release a new episode of Language Access Matters once a month. By featuring expert practitioners and individuals with diverse experiences, we aim to broaden the scope of our discussions and present a comprehensive view of the importance of language access. We encourage you to stay connected with us through our website, www.equalaccesslanguageservices.com, and our social media platforms. You can join the conversation, ask questions, and share your own stories and experiences. If you want to be part of our podcast, email us to podcast@equalaccesslanguageservices.com. Remember, language access matters to each and every one of us. By understanding its significance and actively working towards its advancement, we can create a more inclusive and equitable society. Thank you for being a part of the Language Access Matters community. We appreciate your support and look forward to sharing more knowledge, inspiration, and empowerment with you in our future episodes.